Okay, thank you very much. It's great to be here, and it's also a pleasure to introduce you to to what we did with this great technology, SCION. So this morning we heard a lot about the opportunities, the technologies, the threats, and how we can mitigate them. And also now the speech of Six and Swiss National Bank is a very important base also for us, because we were very heavy inspired by what was done or is done by with the SSFN. What I will do now is first give you a little introduction into what is HIN, the company itself, and then what we are doing for the Swiss healthcare market. So Health Infonet is a community, is a company that is owned by its customers. The customers are the doctors and healthcare professionals, and we were founded in 1996 and provide services to collaborate and communicate for health professionals. Our community, or our customers, is a very, very heterogeneous group of people. And there we have mainly three different groups. We got the individuals, the health professional working in the doctor's offices, or in small institutions. Then we got the bigger institutions, such like hospitals, clinics, or other healthcare institutions. And then the application provider providing services for these professionals to do their work. And all day, they have to work together. And what we provide to them since many years is technology, our product services to collaborate, communicate, such as secure mail, secure messaging, also secure video conferencing, and also some collaboration tools to make the health professionals' lives easier to work together. And to have that all, to access that all, we also maintain some identity services. We have identities that are allowing to access all that services that we also provide as a single sign-on in the market, which means that if a healthcare professional signs on in the morning on his computer, he will be automatically connected to the services he needs to fulfill his tasks. And this all we call there, it's the HIN trust space. This collaboration is based on these tools. And as you see, everything is depending on an internet, and a secure and reliable networking of the various stakeholders is, in the true sense of the word, vital, because a lot of all these stakeholders playing in this market or working together, they are depending on a secure and reliable communication path or the internet. And as you mentioned, there also, if you imagine that if you look a little bit back, we got the doctor's offices and all the work was done there or in a hospital. But in these days, also in the healthcare market, there is a huge transformation to decentralization, which means that a lot of tasks, a lot of the parts or different stages of treatments are done in different locations, and only this fact causes that a secure and reliable communication is very, very important. And this brings us to give our trust space or a new dimension. And that's the reason why we created the Secure Swiss Health Net. And that's a very, very familiar name to the Swiss financial network. So, and there we take profit from, or want to take, bring all these advantages and benefits to our customers. And there, these are, I will not repeat all the benefits now that the SCION technology and all the processes around it will bring to our community, but there is one thing is very important to us. We, thanks to the huge support of SIX and Swiss National Bank, we were able to rise our network, our community, in a very, very short period of time. And since end of last year, we are live with our SSHN and are able to take benefits or are able to bring these benefits to our customers. But sometimes we were discussing within our company about adoption rates, and then we always said, "Oh, the banks, that's a little bit easier there because they have to." But I think it's there. And I appreciate very much your presentation before. It's about collaboration, it's about communication, it's about showing to people what's needed to join this company. And I think this Swiss Secure Health Network. And what's really different to the SSFN is that we have equipped 50,000 health professionals with the possibility to access a SCION network. And this is really a special thing, that all these doctors in the doctor's offices have the possibility to connect into the SSHN via the gate services from the ISPs. And this is also a huge benefit for the community, that if an institution decides to join the SSHN, they can rely on that their customers or their partners are already in the network and have the possibility to access the SCION-enabled services of these service providers. And therefore, because we know within our community 3 connection options. So the one is the option. The first one is the option that you already know, that we have discussed before. These are the institutions installing edges and are participating in this network. The second group is we call it passive participants. These are the gate users that are customers or members of the HIN community. Then they can use it. And the third group of users are the non-HIN members or not HIN customers. They can use it also, but they have to pay in another way for it. The goal of the SSHN is really to provide a secure and reliable network to the healthcare market, that they can do their business in a secure and reliable manner in the internet. But I mentioned before, in our market is a very, very heterogeneous market, and there are a lot of very small entities that are not able to take care a lot about IT or IT services, and therefore we need or we created an ecosystem that is able to provide all the needed services and services and technologies to our customers, and this ecosystem is really a very important part for the success of the SCION. Developing, we are on the beginning of our journey, and what we want to do, or what we want to provide, is a development of the ecosystem in several stages. In the healthcare market, we talk about three pillars or three groups. The first one are the Leistungserbringer. These are all the doctors, the clinics, the hospitals that really are delivering the health services. The second ones are the insurances, the Leistungsträger, the companies or the institutions that are paying for all these services. And then the last but not least is these are the patients. And in a first phase, we provide all these services to the bigger institutions, the hospitals, the clinics, and also pharmacies, to really also make them provide them with all the benefits that they can transform more and more business, more and more services into the internet, and also follow then the developments and the changes within our market. Next step will be, or is already in progress, the insurances, and also some ideas or concepts are very appreciated or also discussed, how to bring also patients into the networks, because the patients are the customers of our customers. Then, so we have also to take care about that. So there, I think it's a lot room for innovation, room for new technologies, and room also for, like you mentioned before, easy things, and very in a broader community usable services. So thank you very much. This was a short insight into our what we are doing for the healthcare market, and I'm happy to answer questions then.